You're all welcome to this channel. Today I will present to you common health problem during pregnancy. There is so many health problems, health complications during pregnancy. And pregnant women must take note of it and know how to prevent it. Please subscribe to this channel, like it, and share it with your friends for more healthy talks. In pregnancy, the body changes due to hormonal concentration and other form. Even those people that did not feel sick when they were trying to get pregnant, they were so healthy. But pregnancy brings change. So some women experience health problems during pregnancy, and some of the implications can be the mother's health or the fetus health. Even both of them can occur. I will mention some few common health complications during pregnancy. Number one, these are the some common health complications during pregnancy. Like I said, I will mention only a few of them. Number one, high blood pressure. Number two, it can lead to some people experience what we call gestational diabetes. Some have infections. Some is preeclampsia. Some is pattern labor. Then others have excessive depression and anxiety. Some is pregnancy loss or miscarriage. Then stillbirth and other complications. And let me try to explain one after the other to see how this is a major complications for women during pregnancy. High blood pressure, also called hypertension, if it is very high, that is above 140 and 90, that is 140 for systolic and 90 for diastolic, when you measure it, is lead to hypertension. Occurs when the arteries that carries the blood from the heart to the body organs become so narrowed, and there will be much pressure for the blood to pass through. This causes pressure to increase in the arteries during pregnancy, and this can make it very hard for blood to reach the plasma, for the blood to reach the placenta, which provide the nutrients and oxygen to the fetus. This also will reduce blood flow and slow down the growth of the fetus during pregnancy. When the child in the womb need more nutrition, need more nutrients, need more blood. So when there is, and this is the blood that carries these nutrients, when there is high blood pressure, there will be decrease in the blood for blood to reach it, because the arteries will become so narrowed, thereby causing problem. Both the woman and the child will not receive more blood, and this may lead to stillbirth or miscarriage. Another one I want to get explain small is what we call gestational diabetes. Gestational diabetes occur when a woman who did not have diabetes before pregnancy develop a condition that is during pregnancy, start going normal, have a good urinating often, getting so many urine, weak, more sugar level. That's what we call gestational diabetes. Normally, the body digests the if part that produce all this sugary part. The sugar in our body is main source of energy. So to get glucose out of the blood and into the cell of the body, the pancreas would make hormone called insulin, and this insulin regulates the glucose level in the body. So in gestational diabetes, hormonal changes from pregnancy cause the body to either not make enough insulin or not use the normal insulin that's there because of there is a lot of changes in the body. So the body may not be able to take or to make more of the insulin. It become a problem. It may lead to gestational diabetes. The woman will void urine more time than before. And if it's not treated after birth, it may lead to diabetes type 2. Another one I want to discuss here, complication, is infections. Infections included sexual transmitted infections, STIs, may occur during pregnancy, even during delivery, and may lead to a lot of complications for a pregnant woman. Pregnancy and the baby, even during delivery. So infection can pass from the mother to the infant during delivery, like HIV, like those things, some diseases occurs. So these may lead to pregnancy loss. It may lead to pattern labor during delivery. It may lead to birth defections. It may lead to stillbirth. It may lead to the newborn being dead. So much problem because of the infections. So the pregnant woman need to treat this sickness. Another one that we want to put in is preeclampsia. Preeclampsia is a very serious medical condition that can lead to pattern delivery and death. The causes of this disease is unknown, but some women have a very high risk of it. What are the high risks of someone to have preeclampsia? Is one, first pregnancy. Second, preeclampsia in previous pregnancy. Existing condition of high blood pressure, diabetes, kidney failure, kidney disease, and system loops in the woman, or a woman that is above 35 years of age, or someone that carries more than two or three children, fetus, in the womb. Another one is obesity. Those are some of the things that can lead to the risks of this preeclampsia. This preeclampsia is excessively increase in blood pressure. There's what I mentioned I call pattern labor. Pattern labor is a labor that begins before 37 weeks. Normally, labor cycle begins around 42 weeks, but any labor that begins before 37 weeks is lead to what we call pattern labor. Unless if care is not taken, the child will not survive because most of the organs in the body have not reached maturity. The development stage is still underdeveloped, like the brain, like the liver, like the lungs will still be underdeveloped during 37 weeks. So if the woman have developed labor during this period of time, you need to undergo series of processes before the baby can be alive. So this is one of the complications and need to be tested. Some is because of the testosterone, other hormonal changes can lead to this issue. So someone that is pregnant, a pregnant woman going antenatal, need to test it, need to undergo run tests every time that is going to antenatal to see whether you have to develop this type of sickness so that they can treat it very fast. Depression and anxiety is very, very important. These are all the mental health because of mood change, because of hormonal changes, because of situation changes. Everything in the body starts changing. This may lead to depression. This may lead to anxiety that may affect the pregnant woman and the baby. Another condition is miscarriage, that's pregnancy loss. Miscarriage is a term used to describe a pregnancy loss from a natural cause before 20 weeks. The signs include like vaginal spotting, bleeding, climbing, fluid coming out from the body, start bleeding before the 20 weeks. It leads to miscarriage. It is a lot of things that lead to this miscarriage, as we mentioned before. It may be a preeclampsia, it may be infection, it may be something like that. So a pregnant woman need to undergo some process. You need to meet a doctor, a gynecologist, or any healthcare professionals to treat and get some treatment. Stillbirth is loss of pregnancy after 20 weeks. When the baby lost after 20 weeks is what we call stillbirth. Say because of issues that lead to that disease. Other complications may be severe, persistent nausea, vomiting. There's a lot of vomiting, especially during first trimester. A lot of vomiting, especially first pregnancy, and insufficient iron that may lead to anemia. Some women changes color. You see, the color will change to yellowish color because of lack of iron, and it will be lots of blood and lack of vitamin B12. So pregnant women need to take care of themselves and take care of the fetus in the womb so that both the woman and the fetus will be alive and they deliver well. Take care. Please subscribe to this channel. Like this video. Share with your friend for more health talk. The next time I want to present another video, I will present health benefit that these women can do, what they should do to prevent all these medical complications during pregnancy. Thank you.